Hey everybody, welcome back. We're going to be talking about first aid and what beauty professionals need to know, okay? Let's dive right deep into it. Today we're breaking down first aid as it's taught in our educational system with Pivot Point. Now, more importantly, how it actually applies to real salon and spa and clinic situations. This is not being a medical professional. This is about knowing how to respond correctly, safely, and professionally. First aid, why it exists. First thing Pivot Point wants you to understand is that first aid is immediate care, not diagnosis and not treatment. Our role as beauty professionals is to reduce the severity of an injury, prevent infection, and protect the client, and know when to refer out. We support the client until further medical care is needed. We do not, and I mean do not, replace a doctor, nurse, or EMT. Time for universal precautions. Now, Pivot Point teaches universal precautions, meaning that every client is treated as if blood and body fluids can be infectious. That means gloves are worn when blood or open skin is present, and hands are washed before and after first aid. Contaminated materials are disposed of properly, tools and surfaces are disinfected immediately, and this connects first aid directly to infection control. Common salon and spa injuries that we're going to be focusing on today are realistically happening in our industries, such as minor cuts and nicks, abrasions, burns, chemical, thermal, or friction, mild allergic reactions, and dizziness or fainting, nosebleeds, and if the injury is severe, worsening, or outside your scope, you stop the service and refer out immediately. Let's focus on cuts and bleeding. Basically, kind of like a step-by-step logic. Now, here's the correct response to cuts and bleeding. Number 1, stop the service. Number 2, let's put on some gloves. Number 3, apply clean gauze. And 4, use gentle pressure to control the bleeding. Number 5, let's go ahead and clean the area if appropriate. And number 6, cover with a sterile dressing. Number 7, dispose of contaminated materials properly. And if bleeding does not stop, that is a medical referral territory. Let's focus on burns. We have to know the cause first, FYI. We have to emphasize on identifying the cause of the burn before responding. Now, general rules, guys. Remove the source immediately. We gotta cool that area, not ice directly onto the skin. Never, and I mean never, pop blisters. Do not apply random products either. We have to maybe cover lightly if needed and refer out if it's super severe. This is especially important in aesthetics and nail services as well. Let's talk about allergic reactions. Recognition over treatments, everybody. We are trained to recognize allergic reactions but not treat them. It's a fine little line right there. Signs may include redness, swelling, itchiness, hives, watery eyes. Usually your steps are going to involve stopping the service, removing the product, keep the client calm, of course, and refer to medical care if the symptoms escalate, guys. Now, some people may experience difficulty breathing, which that is an emergency. I definitely need you to call for help, medical help. Let's go towards fainting and shock awareness. Now, this includes basic awareness, everybody, from fainting to shock. If a client feels like they're gonna faint, usually lay them down flat. After that, go ahead and elevate the legs slightly, but loosen also any tight clothing. Do not give them at all any drink or food immediately, and seek medical help if consciousness does not return quickly. Guys, during this process, they tend to feel a little stress, heat, dehydration, or anxiety kicks in, so just be super careful with this. Let's dive into your first aid kits. And honestly, this is your professional responsibility. We expect every salon and or spa to have a proper first aid kit. It has to have gloves, sterile gauze, bandages, antiseptic, wipes, a CPR mask if you're trained. And honestly, please don't keep it locked away. It has to be accessible, and accessibility matters. Dive right into documentation, and this is huge. Documentation is one of the most overlooked concepts. If an incident happens, it gots to be documented. Why? Client safety, legal protection, professional accountability, regulatory compliance. Guys, documentation protects everyone involved. What do we take away from here? First aid is not about fixing the problem. It's about responding correctly, staying within scope, and protecting the client and yourself. Guys, if this helped you, please like and subscribe and share this with a classmate, because knowing this helps you pass State Board, and also it makes you a safer, more professional provider. I hope this helped.